So with my filler injections, I'm in the red portion of the lip, but a lot of people are injecting, especially like that Russian lip technique, as you may have seen online. Hey guys, Dr. Gary here. So as you know, I do a lot of lip lift surgery, and one of the common scenarios that comes up is someone coming in who's had a number of lip filler injections over the years, and they want a lip lift, and the question is, should we dissolve the lip filler before surgery? It comes up pretty often. And so my opinion on it is, if the filler seems to be distorting the anatomy, then I think it's worth dissolving it first before doing the surgery. And I do that at least 3 days before surgery, because when you do the filler dissolving, it swells just from all the manipulation of the lips. So you don't want to do it right before surgery. At least 3 days. My preference is for at least like a week before. And sometimes we repeat it. Sometimes you need multiple rounds to really get the filler out of there. And a lot of times when people are getting injections over many years, the filler will migrate up to the cutaneous lip, so beyond the red portion of the lip and up all the way sometimes to the base of their nose even. So we want to dissolve all of that before starting surgery. Not everyone needs the lips dissolved before surgery, so it's kind of a case-by-case situation, but in general I think it makes sense to do, especially if there's asymmetries, if it just looks lumpy, if I feel like I can't do an accurate surgery because of the filler. It's better to get it out of there. So then the next question is, well, how do we dissolve the filler? Different people, different clinics do it differently. Sometimes I'll tell my patients, like, well, I want you to dissolve the filler. You can do it with me, or you can go somewhere, say closer to home. And sometimes they'll go somewhere else, and there are different, again, techniques to do it. I have a way of doing it that I feel like is very comprehensive. It really gets as much of the filler out as possible with each session, if we do more than one session even. A lot of times just one session is all you need. And this is also a good tutorial for anyone looking to maybe dissolve their filler with their doctor, just so you understand the process. And it doesn't mean you need to get a lip lift. It just means that sometimes the lips get distorted from filler over time, and some people want to go back to their original sort of appearance. So what I want to do here is demonstrate with an example here of a patient of mine where the same type of scenario played out. She was coming in for a lip lift. She had some pre-existing filler. We decided to dissolve it. So I wanted to walk you guys through these series of videos to kind of show you how I do it. I mean, you'll see it in the video because it's actually me doing it, but also just kind of give you additional commentary on the whole process. So hopefully this is helpful. Today we're going to be working on dissolving some upper lip filler. So here we are, just panning
October of 2020
from the right side to the left, and you can see that the upper lip here looks enlarged. It looks like it's been filled several times, and this patient has full lip to begin with, and you might question,
why does she need a lip lift?
Because the philtrum is still quite long, and because she's looking to change the proportions of the lower third of the face to the rest of her face, and we felt that a lip lift could still be appropriate, but I wanted to get the volume of her upper lip as low as possible so that when we do a lip lift and it rolls out that upper lip, so that it doesn't change those proportions of the upper to lower lip ratio too much. So that was my logic here. We are using Hylenex today, which is a hyaluronidase, and this dissolves filler, or HA-based filler specifically. This is an important point. Not every filler is an HA filler. That's hyaluronic acid-based filler. Things like Juvederm, Restylane, those are, but some are not. And so you have to make sure that the patients weren't injected with some other type of filler. And sometimes patients don't know exactly what was placed into their lips, which is unfortunate, but not every clinic does a great job of educating their patients and telling them exactly what they're going to be doing for them. So the Hylenex will only work for HA-based filler. A little bit of this with some sterile saline, and that's what we have in these syringes. So the Hylenex comes in these little tiny bottles, and it's fairly concentrated, and you don't need all of that highly concentrated Hylenex to do a good job dissolving the filler. But what you need is volume. What I do is I cut the Hylenex with injectable saline. So there's a little bit of Hylenex, usually about 0.1 cc, and then the rest of that 1 cc syringe is the injectable saline. And that gives me a really good amount of volume to do what I need to do at the lip level. And I'm using a cannula here, so if you look, there's no sharp point, it's just a blunt point, and there's a side port where the stuff comes out. So a cannula is different from a needle. A needle is sharp at the end, as you all know, and the stuff that you're injecting will come out at the end. The cannula is blunt at the end, so you can put your finger on it. It won't stab you because it's blunt. And then the side port is close to the tip, but it's not right at the tip. It's kind of like if this is the tip, the side port is here, and the stuff comes out of the side port. And so there are times when I like to use cannula for injecting different things around the face, and there are other times when I use needles. So in this case, with dissolving filler, because I don't need any specific, really kind of highly tuned accuracy, and I'm just trying to spread this stuff out and also limit the amount of bruising and swelling and discomfort for the patient, that's why I use the cannula. I'll usually use either a 25 gauge or a 27 gauge cannula, and that's how I do it. It's important to clean the area. You're making little tiny pokes into the skin and then infiltrating underneath the skin. So I use an alcohol wipe in these situations. A lot of people come in, they're wearing makeup, and we want to kind of wipe that off, just keep it really clean. Just cleaning the area here in preparation for two little sites that I'll make on either side of the lip, and we'll use that as our ports to get in and dissolve the filler. So you'll see that in a minute, but what I mean by ports are basically I use a needle. So in contrast to the cannula I was just describing, which is what we'll use to actually infuse the solution, the needles are used to just make an entry into the skin. So if you just put a cannula and you just try to jab the skin, it's not going to go in because, again, it's blunt at the tip. So you do need a needle to make little tiny entry points. It doesn't go deep. It just goes right into the skin wherever you're trying to enter. So for the upper lip, I'll make one on either side at the ends here. And then for the lower lip, I usually just make one on the right side of the patient because I can easily get across on the lower lip. The upper lip, because of its shape, it's a little more challenging. So I'll have to work from either side. So here I'm making an access point to be able to get the cannula in. Here's one. It does not have to go deep, just under the skin. And then I'll make one on the other side. So this is a needle making the access points. And before I make these access points, I'll usually use a topical numbing cream. So it's really almost painless when you're getting these tiny pokes. It's a special numbing cream that's made up of betacaine, lidocaine, tetracaine, and we leave it on for about 10 minutes. It really helps numb the area. Cannula, which is blunt, is going to go in that area there and underneath the skin. The tiny pokes are really, really small, and the only way I can find them later on when I'm going with my cannula is by the little tiny spot of blood that it leaves, and that actually shows me where I need to go. So you can see the spot where we made the little entry port right here. So we're going to use that, insert our cannula underneath the skin. So you can see what my left hand is doing. I'm kind of stretching out the skin because the lip tends to bunch up. So I stretch out the skin and then I'm kind of guiding forward with my right hand that has the cannula, and I'm always feeling with my left hand to know where my cannula is at all times. And before I actually inject, I'll kind of try to create these tunnels of where I want to be, and then we start to infiltrate throughout that side. See it now, it's over here. And we're going to glide about halfway. Doing okay? Mm-hmm. I'm going to go about halfway, which is there. And then I'm going to start to release some of this fluid. And the lip is going to get more full because we're putting all this volume in it. But then as the swelling and the fluid gets absorbed, it almost looks like you had filler done after this procedure, because all of that liquid that we're putting in has to fill up the lip. And then over the course of the next few hours, it starts to come down. But then over the next few days, you do get some swelling just because of all the manipulation. Lip will appear less full because it's going to dissolve the pre-existing filler. So I'm going to do about half or so, maybe a little more than half, in the red portion of the lip, and then I'm going to go up into the skin region. Up here, you could see the cannula is all the way up here, because a lot of times when people are injecting filler, they get the filler up into this portion. So this is all being done in preparation. When I do lip filler, I tend to avoid the vermilion border, and I never inject into the philtral columns because it doesn't end up looking good, and because that filler ends up migrating quite a bit. So with my filler injections, I'm in the red portion of the lip, but a lot of people are injecting, especially like that Russian lip technique, as you may have seen online. The injection comes in from the top, and it includes the vermilion border. Anytime you're injecting the vermilion border, the likelihood of migration and spread of that filler is much higher. And so that's why when I'm doing the dissolving, I'm taking into account the most common sort of techniques that people use to inject the lips in the first place, and we're trying to get rid of as much of that filler as possible. And I like there to be little to no filler that's distorting the appearance of the lip so we can properly execute surgery. All right, so you doing okay?
Mm-hmm.
Okay, almost done on this side. So we are almost done. You can see just about done here. And great, so that's it. That's the whole process for that side, and you don't need a suture because the hole is so tiny, so small, it closes up on its own in a matter of an hour. And now here we are on the opposite side. It doesn't matter which side you start on, it's just sort of doctor preference. Part of actually getting into the, and you can see here I'm struggling to even find the entry point because it's so tiny. So if this is I think this was a 27 gauge cannula. About halfway here. And for a 27 gauge cannula, the needle is a 25 gauge, so it's really small. Just to put it into perspective, when you're getting your blood drawn, they're using a 21 gauge most of the time, and the lower the number, the bigger the actual needle. So 25 gauge is quite tiny. Sorry. There we go. So again, stretching the area out so I can better distribute the hyaluronidase. You can see it going in. And then redirect more north into the area between the lip and the nose, because that's where we're going to surgically be working. Sorry about that. And you can see we're just about halfway done. And redirect back to the red portion of the lip. And oftentimes you can actually feel the filler, like you can actually touch it with my left hand, I palpate it, I can sense where it is, and that's where I'm directing the fluid. The other thing I should say, when you're mixing the injectable saline and the Hylenex, I like to really kind of combine it well, like shake, 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 so that you're distributing it throughout your syringe that you'll be placing under the skin. And then from either side, I'm crossing over the central portion, the midline, and kind of getting that from both sides, just to kind of double down, because a lot of people will, when they're injecting filler, again, they'll put a lot into the Cupid's bow area, so I really try to hit that hard with the dissolving. Great, so that concludes that video, which was showing you guys how I dissolve lip filler prior to lip lift surgery, or for a patient who has just had enough of that look and wants to reverse it back to their original. Remember that, and I'll do a separate video on lip filler, especially some of the drawbacks. I'm not anti-lip filler, I still do it in my practice, but I think it has to be done tastefully and it has to be done with some caution. And one thing I've noticed is that the actual red portion of the lip can stretch with the filler, and even after you dissolve the filler, the lip just kind of stays bigger and floppier. So there are definitely downsides to doing filler in the lips over time. So the lip lift surgery oftentimes can counter a lot of those, but I realize that a lip lift is not the right solution for many patients, and so it's just about picking the right procedure for each individual patient. But hopefully you found this lip filler dissolving video useful, and if you did, make sure to subscribe, like the video please, and more to come. Thanks guys, see ya.